behalf of the committee, I would like to extend a very warm welcome to all of you. We appreciate you taking the time off from your busy schedule to be here and to join us for today's program for the launching of mental health program in cancer care. And we do hope that this will be a fruitful event for you. Yeah? So to start, we are pleased to call upon our President of National Cancer Society, Dr. Sundari Sundram. Soma Sundram, sorry.
Thank you. Good afternoon, everyone. And as Tika said, thank you so much for giving your time to us today. Today is World Cancer Day, and I'm the colors of World Cancer Day. My one and only orange that I do have. But World Cancer Day is something which has been going on now for, I think, about 10 years. And it's to really highlight the gaps and the areas that we need to advocate for changes within cancer care. So today at the National Cancer Society, we are focusing on psychosocial support, on counseling and clinical psychologists, and the need of such expertise within the country. I have been told that in terms of dedicated counselors and clinical psychologists in terms of cancer care, and I say dedicated because I know everybody does a little bit here and there, but dedicated wise, there are less than 10 in the country. And we all moan about not having enough oncologists in the country, not having enough surgeons in the country, but having less than 10 for something which is so incredibly important and in many ways stands side by side to the therapeutics that is required to treat cancer. Mental health is equally important. So in that sense, we need to make a change and we need to close that gap. And so today, for the National Cancer Society, we are so grateful that you're here to assist us in addressing this issue, which is so critical to not just the mental health of people with cancer, but to the overall health, the holistic health of someone with cancer. So thank you so much again for being here, and I hope you enjoy the rest of the afternoon.
Thank you so much, Dr. Sundari. And yes, so we are here about mental health, and mental health being quite a taboo topic in our society. So what we need here is more sunlight, more candor, and more unashamed conversation. And what better way to start off here is to have a forum here. And we welcome Mr. Jefferson, our in-house clinical psychologist. And we would also like to welcome our distinguished panelists, which is Professor Dr. Elvin L. right? Is the Associate Dean, the international side of School of Medical and Life Science at Sunway University. And we would like to also welcome Encik Muhammad Al-Hadi bin Hussein, the lecturer and registered counselor from the Faculty of Education and Humanities, UNITA. And of course, the last but not least, Madam Siti Zubaida binti Mustafa, the Director of National Coalition of Mental Wellbeing. Please.
Right, okay. I apologize everyone for some changes in the logistics. Hopefully we are all well rested now and can proceed with our form. Right, thank you MC for introducing us today, and we'll start off our event, a launching event with a forum to understand better of the mental health landscape among non-communicable diseases, right? And I'm Jefferson, I'm a clinical psychologist working under NCSM Malaysia. Right, so let's welcome our panelists for today. So let's start off with Dr. Alvin Ng Lai-Un, who is an associate dean in the international side. Right. So Dr. Alvin is was the founding president of the Malaysian Society of Clinical Psychology, which he set up in 2010. He also ran the Master of Clinical Psychology program at the University Kebangsaan Malaysia, which I am graduated from, which is it's an honor to meet you. And currently he is a professor of psychology at the School of Medical and Life Sciences in Sunway University. So welcome, Dr. Alvin. And next in our panelist is Mr. Muhammad Al-Mahdi bin Hussein, who is a research counselor as well as a lecturer in UNITAR International University. He has been actively involved in psychological talks and currently pursuing a PhD in education with a focus on positive psychology, happiness such as happiness, well-being, and also life satisfaction. Welcome, Mr. Al-Mahdi. And of course, lastly, we have one city supervisor, right, who is a Rotarian and also a past district governor at the Rotary International District 300 in Malaysia. She's currently a director and also a chairperson at the National Coalition for Mental Well-being, which was also initiated by Muslim Malaysia, right? Thank you so much all for coming in today, and let's start. So to begin with, for Mr. Muhammad Al-Mahdi, can you actually shed some light, into the intersection between mental health and non-communicable diseases such as cancer? Like how can these both actually affect one another?
Thank you, Mrs. Jefferson and everyone. As we can see, when you talk about the mental health, right? So, of course, it is interconnected with the NCDs, right? So, we can say that because I'm involved in all of these things, and you can see that if you are diagnosed with the NCD, for example, of course, you will have some of the different range of emotional responses, like you will feel fear, overthinking, correct or not? You will feel depressed, right? Anxiety, stress, and so on. So it is like, you can see that it's integrated, with the mental health. It is not only that, when you have a treatment, for example, you can see that after the chemotherapy or the radiation, especially for the cancer survivor or the fighter, of course they will have so many things. For example, like vomit, and then they have what we call that dizziness, correct or not? And then they will feel all of this. What we call that. We can say that is intercorrelated with the mental health. So I think that. As a first, that is only the first thing that I'm going to explain first. Yeah.
Right. So what I understand is that the changes that comes along with treatment and also the trajectory of the treatment itself, the side effect itself has brought up so much of mental health impact, right? Because that fear and the uncertainty as well, right? So change itself is inevitable, right, for a person who is undergoing this treatment for NCDs, right? So for Dr. Alvin, when change is inevitable, right? So what form of changes would there be, and how can mental health care professionals actually address all these changes?
Well, thanks for the question. Change is a very, very big topic, I would say, because if you think about any kind of change for the better, change for the worse, any kind of change brings about a lot of stress. Think about big changes such as getting married. May sound good, but in planning, in preparing for it, huge stress. Yeah, getting a baby, talking about good stuff, lots of stress. The whole process itself, going through the change, is very big. And if you were to talk about NCD, it's not even treatment. Just getting a diagnosis itself, is what Al just said just now, can trigger off all kinds of thoughts. Because when you get a diagnosis, the immediate change that you get is not so much even starting treatment. It is the role that you have. Suddenly you have a role of being a patient of a particular NCD. Usually when you get diagnosed, there's all kinds of thoughts really, oh no, what do I do now? What's going to happen? What's going to change? Right? And when the doctor tells you need to be doing this and this and this and that, and that's just what the doctor tells you. And this is where I start answering your question, because when it comes to any kind of medical treatment, there is attitude change and behavior change to go through. The way you think has to change, The way you behave has to change. You start taking medication. And what we tend to not talk about is your whole lifestyle that needs to be changed just for you to be on treatment. Yeah. Firstly, financial planning change. Treatment is not cheap. And you got to see the doctor more often. So a lot of practical changes which can also take over your whole life and affect other people's lives. So you, not just you, the person with the diagnosis, get stressed out, other people as well. And the management of stress in other people and yourself also. That's a lot to handle already. And many, many other practical things that would change in your life that you may not even think about when you're talking about medicine. Medicine is just the one thing, but everything else will change, and that has tons of impact on our mental health. Because suddenly you are made to think more than you are used to. Suddenly you are faced with tons of problems that you don't have immediate solutions to. How do you feel when you have got lots of problems and not enough resources? Very stressed out, right? So when you don't have enough resource, you need to look for resource. At the beginning, you don't know who, you know where. So that is where the high stress comes in, and that's where there's a lot of support that needs to be given to anyone, individual as well as their family members, with regards to all kinds of support, knowledge support, social support, medical support, so many things. So, I mean, just in a nutshell, I hope I'm giving you, an idea as to when we talk about change, it's not just about the treatment. It begins with the diagnosis and the change of role that you're not used to being, and we don't want that role of being a sick person, someone with a diagnosis. No one likes that. Which is why a lot of people tend to not want to go for health screening because they're so afraid of getting a diagnosis. And this is a physical health screening, not with mental health screening. Mental health screening is less. But I hope that answers the question.
Yes, I agree with what Dr. Alvin says. The diagnosis itself can cause a ripple effect. From a diagnosis, it causes more towards the society, not just the person itself, the family members, anyone around the person diagnosed with NCD will get affected eventually. Right? And also, I agree with what Dr. Alvin says, the resources that we need to look for. And if we don't have the resources, then that is where the issue comes in. So that leads to my next question, talking about resources, right? So I believe that there are a lot of gaps or unmet needs for persons with diagnosed with NCD, right? So how can we support this individual, and what are the advocacy efforts that we can do? So like, Madam Siti, to answer that question.
Thank you.
Okay, thank you. We have heard from El and also from Alvin, and with all the changes that's happening. Yes, as an NGO, as an organization that advocates for mental health, a holistic thing where mental well-being is so crucial in our society today, I think there's a lot of gaps. That's what we can see. It's just not the role of government agencies or not the role of medical practitioners. But I think there's the role that other NGOs, other groups have to play. And I think these gaps very crucially is professional help. I think that's very crucial. Where you don't have professional help, professional counselors coming in, it's also going to be very difficult. And we need to increase our level of professionalism in terms of the capacity building in these areas to help and support mental health, or even in adapting to these changes. So NGOs like us, when we start to advocate for good mental well-being, the end game is to be able to create an awareness in our society that while we try to seek help and while we encourage people to seek help, we also need to be able to provide them with the necessary tools, the necessary areas or necessary avenues that they could reach out and get the right help. And that is where we are lacking at the moment. I mean, like Dr. Sandri was saying earlier, we have 10 committed counselors in the country just for cancer care. I mean, that's really pathetic. So that's only talking about cancer. How about other NCDs? We're talking about even there's a huge demand right now among our adolescents. And NCDs among adolescents is also another another area that we are facing right now. While we don't want to neglect it, but we really need to bridge that gap of how NGOs, this partnership between NGOs, professional bodies, and the government agencies to bridge that gap. So there must be a partnership between all the stakeholders being able to address and adapt to these changes.
So you're speaking in terms of the organization, what the things that organization can do, right? But the individual, like the mental health professional, how can they actually advocate for the need to support people get responsibility?
I think as far as the professional is concerned, is to be able to recognize other professionals coming into, it's just not dedicated to what we found is sometimes we have counselors, we have psychologists, we have psychiatrists and other medical, but there is also a tendency of non-communication between the professionals. That is, we also see that in the ministry level, right? The inter-ministry, we talk about Ministry of Health, we talk about social welfare, and then you're talking about the other. There's no inter-ministry to be able to communicate. And we find that even in the medical profession, there is also this gap between the professionals, that there must be a collective effort that we see in one direction, where these professionals can come together, working with the NGOs, so that we will be able to collectively take on a responsibility to address these issues. So I think the professionals play a very important role, because we as NGOs or we as advocates, we rely on the professionals and the experts, like for example today's forum, to be able to then curate programs or curate avenues for the public as an outreach, working with the professionals. So that relationship is also very important.
Right. So the community among the mental health professionals is needed, well needed. And today is such a good opportunity that most of us have interest in the oncology section. So today is a good opportunity to network with each other and hopefully form a community that provides this well needed support for people in cancer, right? So moving on back to Dr. Alvin, right? And I noticed that you passed the microphone to Mr. Al. Okay, right. So just now you are speaking about like the attitude and the behavior, right? So can you explain further how this can actually affect, and not just the attitude, how about the social, the environmental part? How can this affect the mental health?
You're asking a huge question. Are you prepared for like a 2-hour lecture? There's so much to answer over there. You talk about attitude, you talk about behavior change, social change. Well, beginning with diagnosis alone, hearing something you don't want to hear, it can get you stuck in just thinking about worrying, overthinking, to the point that day itself, on the day you receive a diagnosis, most things that you normally do don't get done properly. All right, that's a huge disruption. And to even get used to having a new label, for example, a role, that takes time. Yeah, you go through ups and downs, because you also need to help other people understand what you are going through, which usually fails. My experience with a lot of people with any kind of diagnosis, they have difficulties getting support. Many people would give them all kinds of advice, right, that they may not really need, but they're understanding. So when you are struggling with a new role, a new, identity of sort, others are also struggling to get used to that new identity, right? That's where I mentioned attitude change. You can have a negative attitude towards it, you can have a positive one, you can both. They come and they go. You start having 2 extra angels and 2 extra devils on your shoulder, and they're all fighting, right? Because it's so new. They need to start making peace first. That's just attitude. Behavior change. Suddenly you need to take medication, you've got to go and see doctors very frequently. Do you have the transport? Do you have the money? Right? And your family members, are they free enough to be with you? Do you have to ask for leave if you're working? What do you tell your boss? You get all these questions, all this maybe, and HR is not necessarily the nicest people around. Sorry, HR people from here. I'm saying that because it's true. You laugh also because it's true. So we need to also engage with HR people to better understand what goes through a person's mind and the kinds of changes in behaviors they have to make. And many of these changes are long-term. And these changes are also quite unknown because you don't quite know what's going to happen. And I think this is where, one city was saying just now that we need to really work together, and I would extend from professionals to the public. I would also want to focus on people with lived experience, the individuals themselves with diagnosis to come forth, be empowered to talk about what has worked for them. What kind of resources would they need that they have found useful, and what can the public do to provide these resources? So there are tons of people out there without jobs. Can they perhaps learn how to provide these resources and then get jobs because then they become relevant? Things like that. So that kind of change, social change. Suddenly your social life changes. Your best friends are not doctors and nurses and anyone else in the hospital, or could be a support group, perhaps, if there is one. So basically lots of changes that needs to be managed. And this is where we want to talk about which profession actually helps with those. The specialists, do they do that? No. They diagnose, they prescribe, they say, come and see me again 3 months time. Doctor, 3 months time. Next, please. Talk to nurse. What do they do? They're too busy doing other stuff. Who do you talk to? Basically, no one. Right? We're so used to that medical model. Go to the hospital, you go out. In between, who helps you? Where to get resource, everything. Yes, sometimes the hospital, the nurses will give you some resource here and there, but those are mainly medical stuff. Who helps you with the behavior change, the readjustment of your lifestyle? This is where the mental health professionals come in. How to adapt to your behavior change, attitude change. Most people think when we bring in mental health professionals, it's about psychotherapy. Not yet. You don't need psychotherapy. You need help adjusting. And a lot of people don't see that when it comes to need help adjusting, this is where mental health professionals come in. And because the word mental it's got such a huge stigma, so why do I need to go and see the mental professional? I have cancer, I've got NCD, I've got diabetes. Why mental health? I'm not crazy. Hey, you're not. But you need to adjust. Certain things you need to learn so that you can better manage what you have, this new role, this new identity. So these are the things that need better awareness. We need to speak up more. And mental health professionals, medical professionals, basically everyone. And those of you who are here, hopefully after this you go shout out in your social media, make a lot of noise. Jefferson, I heard about you before. Make noise.
I would definitely do that.
Yeah, you're too shy. Not good. Good thing we're doing this now. We all need to make noise, need to connect with each other with noise. Otherwise, the same more people come up. Yeah, I don't want to say you're out there. Right. Yeah, I think I better stop talking now. Really,
Yeah, I think Dr. Abhi just reminds us that mental health professionals not just provide therapy. We need to put on so many other hats to make sure that they actually adjusting well.
So on that note, I want to shout out for social workers. We don't use social workers well enough. They are trained to provide this intermediate kind of help. Where are they? Why aren't they celebrated? So next time, panel like this, please call social workers. Please have more social workers in the house. I think they're really wasted.
The society itself is so important, right? So speaking of society, Mr. Al-Mali, how can the social support, how can we incorporate social support into our intervention, into our counseling process, providing these services to the person with autism?
I agree just now what Dr. Alvin says, that sometimes we lack of the support, from the family members, even, not only from the community, right? Okay. I think that the first important thing that we need support, right? That's why we have this National Cancer Society, for the city, the National First of Mental Health Wellbeing, and all because we want to give support. Sometimes people don't know what to do because they don't know how to seek to the professional. Okay, actually, there's a lot of the people work support us. Number two, I would love because we can see in the University of Pennsylvania now they're doing about the positive psychology, where Dr. Martin Salman come up with very much theory. It's very good. How are you going to enhance your well-being and also your happiness and so on. I think the engagement or activities, you have to do activities, keep doing activities. Okay? Because if you do activities only, maybe you can stop from overthinking or negative thinking about all of these things. Okay? If you didn't do any activity, even the small thing, that's why the people, for example, who have a depression, right? Even though they want tonight, I already told them that tomorrow they're going to brush the teeth. Tomorrow they're going to take a bath, for example, and then after that they're going to buy some groceries. They have to write down because activities will help them. Okay? If you don't have activities, you lock yourself in your room and then you don't want to talk to the people, fill in the blank. What will happen to you? Okay? So engagement is very important. Okay, and then we can say also the other things that you must have regularly monitor your health, right? So this is very important that maybe in the family especially, they also can join some activity and understand. That's why I think that we always have an awareness, education, and all of these things, to educate, the people. Because many of the people, they don't know. Sometimes people don't want to find the solution, right? That's what people say, if you're not part of the solution, you are part of pollution. That's why you are pollution. Right, okay? If you cannot give any ideas, okay, at least you can support, right? What we call that social support and so on, okay? And then another part that I can see is about acceptance. The concept of acceptance is very important. Last time maybe you didn't get a cancer, not diagnosed with a cancer, and then of course your personality is different. Okay, you're very rigid, you're very dogmatic, for example, you're very strict for something because you're a boss. But now when you're diagnosed with the cancer, for example, of course everything changed, correct or not? Okay, so everything will change. So sometimes you cannot accept it. Okay, you have to understand that life goes on, and a lot of people here, we want to support, right? So that means we have to, we can say that when we engage with the activity, and then we also join whatever that the other people offer, so it will be good. I think the last one that we have to do is mindfulness therapy. Okay, I believe that in our university, I do a lot of therapy because sometimes people, they're not very good in art therapy. Maybe they're very good in aqua therapy. Maybe they would like to join aqua therapy or dance therapy, or whatever play therapies and so on. I think that National Cancer, so I think did a lot of art therapy and all therapy. So it helps, all of these NCDs people, all right? So I believe that if you come out with this support and then engagement, and then you always regularly check your mental and also your, what we call that, your health, right? And then after that, you also have a concept of acceptance, yeah? And also the last one will be a mindfulness, or whatever therapy that you join. I believe that it will help a lot. Okay, so this now I agree with YCP as well, because we lack of this what we call that professional who really wants to help. You see, okay, I also on TV. Maybe nobody watch TV now. People watch Netflix. So on TV, they also ask to talk about it because it is not only intercorrelated just now. When the NCD people, we diagnose them with cancer or whatsoever. But also, when we say the integral with the mental health, they will take substance abuse, you see, and then they will do smoking, vaping, all of these immoral activities, because sometimes they want to forget. Actually, they don't know. There's a lot of people outside there wants to help you. So don't lock yourself, okay? Don't isolate yourself in the room, Maybe I can cheat a little bit that we also do for the learning disabilities on CP. We can see that until now, so God, that people try to lock their kids who have autism, dyslexia, dyscalculia, whatever syndrome down. This is very bad. You should, open the communication about this thing and discuss further, so that maybe we can help each other. I think
mental health is still considered as a taboo. That's something that we shouldn't touch base on that, because touching base will just open up the box that more pressures, more stigmatization will come along. So I think it's a big elephant in the room, so and we have to address it one way or another, right? And through this forum, we're actually able to understand the things behind the NCD itself, and also what are things that can actually impact. So as a summary for today, right, is that NCD is not just the physical aspect of things. Mental health do come into play. And mental health, not just the mental side, the psychosocial part behind the NCD itself, right? So thank you very much for all three panelists coming today to share our insights and how we can actually move forward from this. Right? Okay, so thank you very much, and I'll pass the session back.
Thank you so much. It was an insightful sharing to all the panelists. We would like the panelists to just take time. Okay, so now we would like Professor Dr. Elvin Encik Muhammad Al-Madi and Dr. Siti Subada to launch the educational awareness series, mental health issues related with cancer and longitudinal diseases.
Oh, okay.
Dr. Summary. It's your show. Yeah, but it's NCD behind, I mean, national cancer behind them. This will not happen without you These booklets can be found in our Tun Abdul Razak Digital Library at www.cancer.org.my. Yeah, and they have 4 languages. They have English, Bahasa Malaysia, in Mandarin, and also in Tamil. Yeah. So now I'll call upon Dr. Dato' Samri to give a bit of appreciation to our training panelists. Yeah, I don't agree at all.
I will call. Thank you so much. Thank you, ladies. Thank you.
And lastly, Encik Muhammad. Thank you so much, panelists and all right, how are we doing? Are we still awake?
Yes.
Yes, yeah, okay, so we now know that what we are here for today, so some of you may be sure about signing up the program, some of you may still be thinking about it. So for those of you who are still thinking about it, let's get more clarification on the program. So I will call upon Ms. Mami Rama to give the overview of counseling cancer care. Welcome, Ms. Mami.
Very good afternoon to our honorable guests and my dear participants for today. Special thanks to Sheikh Muhammad Al-Mahdi from the University of Abdul Razak, a university that played a huge part in molding and shaping me into become who I am today. Thank you, and thank you everyone, my colleagues and everyone. Okay, I'm Malini. I am the counselor from the psychosocial support department. So today we are here launching event of the mental health program in cancer care. So it is truly an honor and a privilege to stand before you today as we gather the launch of our cancer care counseling program. This program marks a significant step forward into our commitment to providing a comprehensive support and care for those bravely facing the challenge of cancer. Cancer, as we all know, not just a physical battle, but an emotional and mental one as well. It affects not only the individual diagnosed, but also their families and friends. I hope everyone agree on this. Okay, creating a ripple effect that touch the life of many. Okay, today we come together to address not only the physical symptoms, but also the emotional and psychological toll that cancer can take. Okay, basically through this program, we hope to provide counseling services that go beyond the medical aspects of cancer care. We understand that emotional well-being is an integral part of the healing process, and by offering specialized counseling, we aim to enhance the overall quality of the life for those affected by cancer. So let's go through our program. And the overview of this program is basically it's a personalized approach that integrates psychological principles with distinctive challenges encountered by individuals navigating through their complexities of cancer. Besides that, it's a comprehensive exploration. We explore more on the approaches, okay, and intervention plans that is suitable for cancer patient, okay, integrating the both technical in cancer care and of course the interpersonal skills critical for providing unwavering support to individuals diagnosed with cancer. Based on my experience, tomorrow will mark my 4th year with National Cancer Society of Malaysia. I'm going to start into my 5th year. So as a person, as a counselor, I work with a different field and different setting. I find that this is a place that I'm blessed with because I got the chance to journey with the cancer patient. I touched many people's lives, and I like to say some of them are still around. I mean, I'm still providing this support, and some of them are no longer alive. So I guess working with a cancer patient is a privilege, and not everyone can do this. Okay, so next. So the aim and objective of this training, of course, we wanted to empower counseling professionals with essential knowledge and skill. Whatever we learn in university through our degree program and master program, the intervention plan, the knowledge is going to be a bit different when you wanted to apply to the cancer patient and their family members. So we're going to empower you with a different counseling skill. Okay, besides that, we're going to provide impactful support and guidance for those affected by cancer. Okay, and of course, it's a foster career development in psychosocial care. As we say, not many are working with cancer patients, not only in hospitals, but any cancer care department. Okay, I met someone yesterday who's working under Ministry of Health, and she mentioned that we are lacking of counselors in hospitals, especially to provide support for the cancer patients. So I guess this will be the great platform for everyone to learn, extra skill on providing the essential skills and knowledge. Okay, next. So we will cover about 10 modules in this program. Okay, the first one will be introduction to counseling and counseling services for cancer patients. What are the benefits? Okay, and of course the overview of cancer care continuum. I do understand from my boss that you always mention that different cancer, different stage, phase, and emotional. I mean, their emotional level, the stress level will be very different. Okay, a person might be diagnosed with stage 1 and stage 2. Their stress level, their depression level might be different with a person when you diagnosed with stage 3 and stage 4. So this is where we're going to learn more on cancer, the types of cancer, the stages of cancer, types of treatment, and of course, type of the effects of the treatment. Okay, so We also will learn more on psychosocial impact of cancer, besides the communication skill in management of cancer patient. Okay, cultural competence in oncology counseling. This is like for us to understand more into different culture and background. Okay, and self-care for cancer caregiver. Okay, from my experience, I do understand the emotional support is always, we always try to provide for the cancer patient, but I find that we should start to do the same for the caregivers, because they'll be going through a lot of emotional roller coaster as well. Okay, so we will guide them for the caregivers on the self-care, and we will learn more on grief and loss in oncology landscape. The grief is basically before something happened, I mean, we prepare the family for the grieving at once. Okay, and counseling intervention for cancer patients, this will be a different, we will learn more into different intervention. For example, we'll explore more on reality therapy, commitment and acceptance, and of course emotional focus therapy, which is specialized for cancer patients and the caregivers. Okay, whatever we learn outside for non-cancer, it's like it will be a different thing, but same intervention, but how are you going to apply this for the cancer patient? Okay, and self-care for counselor, as much we care for the patient and family members, I find self-care for the counselor is very, very important. It is not easy for you to work with cancer patient. Okay, so the self-care for cancer counselors managing cancer patient is important. We'll explain on that, and of course we will look into the ethical consideration, which we will look into the lembaga counselor ethical guidelines. Okay, so this will be the 10 modules that we will look into online session platform, and of course you have to attend for 3 practical or face-to-face session, after the 10 modules. Okay, so it will be 10 lessons, each will cover for 1.5 hours, and who can enroll? Of course, we encourage registered counselor, okay, students or graduates from counseling courses. That's all. So in conclusion, let us embark on this journey with compassion, understanding, and a shared determination to make a positive impact on the life of those affected with cancer. May this cancer care counseling program be a beacon of hope, resilience, and healing for all who seek this help. Thank you so much.
And now let's give it up to Ms. Nikari to present the overview of Psycho-Oncology.
Oh, is that a question? Okay, I'm sorry.
Yeah.
I had a question. In terms of your enrollment criteria, you have, of course, registered counselors, I think. How about cancer survivors who like to attend the program? I'm sharing this with you because I'm a cancer survivor, right? And I feel that whatever we go through and what changes that Prof mentioned during this session, there's a lot of input from us because we are life experience. And sometimes the life experience is so crucial because you can relate to whatever Prof explained, you can relate to it so much, especially when you talk about support. My husband is here and he's been very supportive since the day one, and that family support is so important. So I'm not sure whether you consider some of our what you call cancer survivors who can be part of your program, who want to attend and maybe be able to provide that support. What's your boss saying? I know your boss very much, so anyway.
I need the honor. No, I just want to feel that question.
Yeah.
Thank you.
So I think. So hi, good afternoon. Thanks for joining us. Sorry, that's a really good question, and I just want to pretty much flesh out the continuum that we keep on talking about. So the thing is, and the problem is actually we have not enough manpower, not in CSM as in Malaysia as a country, so to manage mental health. So and we're rightly putting out that different pockets of this need to be managed by different people. So within the pocket of counseling or kind of this area of mental health provision of assistance, we have a separate program that works with the help of survivors, caregivers, and lay people, and that's actually our navigation service. So the patient navigation service serves as the front end. And so pretty much everyone who comes through the system, newly diagnosed cancer patient or a caregiver, they actually run into our navigators. And because that's a wider group of people, we just have more, should I use the term, warm bodies. There's just a lot more people who are able to cope with that service. So at that point, they triage to see whether there are some people who require acute mental health assistance or whether they actually need some kind of support from a counseling perspective to their family and that kind of other backgrounds. So then, post the triage, which is done by our navigators, they actually go either to a clinical psychology service or they go to a counseling service. So the idea is we don't burn out so much our counselors because we don't have as many counselors, and of course the clinical psychologists as well. Both of these are like dinosaurs. Very few, very difficult to find in the wild. So the idea then for these programs is really to strengthen our counselors and the CPs who in Malaysia are trained very generally. They do everything. So now it's the idea, like I would say, this is your Chinese uncle running the mechanic shop, can repair everything. Now we're focusing them to make them Volvo mechanic or any other capacities for their servants. Kita orang created to put. So hope that kind of answers that. So we're happy to have you on the navigation service.
I think that I also believe that the lived experience will be brought into the sessions itself, meaning that we call people in to talk about the lived experience of chances of self-extent, as we get enriched in terms of that.
I think because I mean, I've kind of experienced both ways. I mean, getting support, getting the counselors coming in and sharing, talking to us, but then it's still like not like I've gone through this, so you're telling me something. So it's a living talk. It's slightly different, something that you just want to consider.
Absolutely. Because the navigation service, that actually is a buddy service end to end. They hold you, they meet you every week. So like the counselors or the CPs did that they would quit. So they actually there to kind of offer the professional help, and then the navigators actually offer the personal help. Yeah. So that's what it is.
Do we have any other questions? So we'll invite now Ms. Ikai, our clinical psychologist, to give the overview for Psycho-Oncology.
A very good afternoon to our distinguished guests and our participants. My name is Kai. I'm a clinical psychologist from National Cancer Society of Malaysia. So let me introduce about my role in SCSM first. Basically, what I do here is to assess and also to manage any of the psychological challenges faced by those who are affected by cancer. And I'm also providing psychotherapy and also emotional support when they are needed. Okay, and at the same time, I also do workshop and live webinar to raise the awareness between cancer and mental health. Okay, so I'm so glad and so nervous at the same time to be here to share you all the overview of psycho-oncology in cancer care. Okay, so without further ado, let us look at the slide and see why this training program is so important. Right. First of all, is the issue of holistic patient care. Like we just mentioned just now, normally we tend to overlook the mental health and emotional challenges for those who are affected by a cancer diagnosis. And they are just focused primarily on the physical aspect of the cancer during their cancer journey. Okay, but as we know, because we work in SCSM, you know that cancer patients and also caregivers, they may struggle with like anxiety, stress, depressions, or worry along in their cancer journey. So this is why psycho-oncology interventions is so important and it's a major step forward to provide a more integrated holistic patient care to address this concern. And that's why, this is why it's so important as well to bridging the knowledge gap for clinical psychologists and trainees. Okay, why do I say so? Right? So basically, in the academic program in the General Master of Clinical Psychology, actually less emphasis on the unique challenges posed by people who are affected by cancer. Okay, and this leading to the clinical psychologists and trainee, they are actually lacking specialized knowledge in addressing the complex psychosocial needs of cancer. That's why our program is to design to fill in this knowledge gap and to provide a more specifically targeted module to address this concern, right? So our aims and objective of psycho-oncology in cancer care is to, oh, I'm so sorry. Okay. Right, so sorry for technical error, right? So our aims and objective is to cultivate a specialized skill set required to provide effective psychosocial support to people who are facing cancer and the families and the caregiver as well. Secondly, is to develop proficiency in assessing, addressing, and manage the psychological challenges in the oncology setting. And lastly, is to facilitate the interdisciplinary communications and collaborations to integrate the psycho-oncology into the broader spectrum into oncology care. Okay? So that's why our course outline involves 10 topics, okay, which is psycho-oncology and its role in cancer management, the cancer care continuum, the effects of emotional and psychological effects of cancer and the treatment, and also the common mental health disorder that we can see in cancer and what is their management, and also what are the assessment and screening tools in psycho-oncology and the intervention to manage cancer patients and caregivers and the families, and also how to communicate effectively with the family as well. We do cover this topic, and also understand the family dynamic and with environment, and also edited issues in cancer care. Alright, so who can enroll in this program? Basically, is our clinical psychologists and students or graduates from clinical psychology course or training. You are welcome to apply these courses. And we have 10 lessons, each lasted 1 hour and 30 minutes, right? So, in short, I just want to re-emphasize again that having this training program is not about just like disseminating or giving the knowledge. It's about building a community dedicated to improve the life of those affected by cancer, right? So that's all from me, and thank you for listening.
Thank you, Kari, for the insight of the overview. So now that you've gotten 2 overviews from the 2 programs, we would now like to hear welcome Mr. Tanu Kumar, the General Manager of ECHO India, to share on what the ECHO project is about. How are you all doing?
Do you mind if I pop in a question?
Yeah, sure.
Because I was just wondering, like certain, like especially number 8, like family dynamic and cancer. I feel like the counselor could also benefit from the topics because some of it is quite interrelated. So maybe you can share about what is the differences and whether there will be some, because you're talking about intercommunication, so why not combine certain topics with insight and the counselor actually comes together to share?
Because for clinical psychologists, we are dealing with more like in the mental health disorder, and the intervention is more targeted to the mental health disorder in the cancer patients and caregivers. So we all know that counselor is dealing with general issues. Yeah, so this is the reason why we didn't just combine together. Yeah.
There's another reason for that as well. Like it's really in terms of professional training, we need to keep the courses distinct because there's 2 different categories of professions that are working at it. However, I'm quite sure that you're absolutely right. There will be quite a lot of domain overlap as well, content overlap, but the approach to it will follow each profession. That's the idea. So you may see some, for example, like I think we were sharing, or they were mentioning some, quite a bit of the content will actually come from live patients coming in, speaking to those classes and all that. So to order, in order to kind of give you that feeling. And I'm sure they shared as well, at the end of the program, you still come together for a face-to-face session. We'll be looking at about 3 days and an exam, and then certifying everyone. Yeah.
So hope we answer the questions. Alright. Yeah, welcome, Mr. Tanner. Can you hear us? Mr. Tanner, can you please unmute your speaker, please? While we wait, Ms. Mani will actually speak about what is about.
Okay, ECHO project is basically an online platform where we do our training, we provide our training into this platform. Okay, so Project ECHO is basically an India-based platform. Okay, so basically it's how we will
Basically, we'll get into this project called to train the psychologist and the counselor. Okay, so this we're not just using their platform, but actually they are still having certain like CPs, like pre-assessment and post-assessment. Yeah,
doing evaluation and all.
yes.
Hello, Mr. Tarun?
Okay, so
Okay, Mr. Tarun, can you hear us? Can you unmute please, Mr. Tarun?
Yeah.
Yeah, we can hear you now.
But I can't really just say something like
Hi, Mr. Tarun. Yeah, online now.
Why don't you just type to the proceed? Yeah, just proceed.
Hi, Mr. Tarun. Tarun, are you still there?
Yeah,
Three dots and number 4.
background, so what you take over faculty, develop and we figured out that there were almost 28 competitions in one state, and then this was in the center of the state. There were people who wanted to see it, we had 8 months of free time. So, to reduce that disparity and to ensure that it's no more barrier to people that your being able to start and what knowledge and technology. At this point in time, I'm probably saying that Project Ego is currently working in 70 plus areas and is present in 175 plus countries. And we are working through some of the core principles that I don't know what we believe that we use technology to learn scars and processes. We apply case-based learning faster and easily, share best practices between municipalities, and collaborate and monitor outcomes. This is something that we also call as application technology, case-based learning, best practices between municipality, and database where-based technology outcomes. This is one of the clinics, earlier clinics, on the bond that we have on the larger picture is one of the issues in the conduct that is select on the middle, the team of experts around it, and they are curing by fantasy. And small boxes that we on the various learners or hospitals, clinicians, doctors, surgeons, doctors from all over the state. And towards the end of this case-based presentations about lecture, just to understand the best practices and what are the key takeaways. I understand that one of the most important thing right now, apart from the pandemic, is controlling the NCs. And I'm proudly saying that most of the countries right now across Asia are the health ministries, the Ministry of Pakistan, the Ministry of Myanmar, the Ministry of Armenia, Georgia, India, we have on the state, another country, we have the National Health Mission, and there are some partners. Ministry of International, the Vice National Cancer Center happens to be a partner. University of Thailand, University of Malaysia, and we recently signed an agreement with the Ministry of Trade. This is our global presence. So we have presence in almost 175 plus countries. And if I talk only about cancer, 175 plus countries about more than 550 cancer programs running. And 550 plus cancer hubs, 25 plus cancer programs, and 100,000 plus pregnancies, which is what we already have about cancer. So that's how it is. So, like I said earlier, it was not only about one disease or hepatitis or cancer, we have working in 70 plus disease areas. And I take a pause here, and I take a pause here, and I would like to congratulate for those equally wonderful planning that you have an assigned program on family care and I would want to extend my special thanks to GMC's team, Dr. Sotri. And I know that we have some funding divisions, so I can't hear you. But yes, I'm happy to answer questions and comments that you may have for me on the chat box.
Okay. Yeah, thank you, Mr. Tarun, for that insight of ECHO program. Mr. Tarun, can you hear us? All right, so thank you then for watching Mr. Tarun online and hear what he presented on ECHO project. Okay, so now that we know a bit on what ECHO project is about and also the overview of the two cancer care programs, we would like to call upon now Dr. Sandra, together with Ms. Maruni and Ms. Kai, for the launch of the mental health, the much awaited mental health program. Now. So thank you so much, and this is the official launching of the program. We now present a short video of ECHO project.
Project ECHO is a performance optimizer. Think of it as a high-speed internet connection for the healthcare system. It spreads new medical knowledge throughout the healthcare system, from university medical centers and other specialty care sites to the front lines of community care. Rather than information flowing in one direction, community providers learn from specialists. They learn from each other, and specialists learn from community providers as new best practices emerge. Under ECHO, community providers use video technology to participate in guided practice with specialist mentors. They acquire new skills that allow them to treat patients they otherwise would have referred out. Patients with complex chronic conditions get high-quality care where they live from providers they know. No waiting months to see a specialist. No long drives back and forth to get critical care. ECHO exponentially increases access to specialty care by moving knowledge instead of moving patients. Suffering and pain are reduced, and lives are improved and even saved. Project ECHO, changing the world fast. Join us at echo.unm.edu. So you've got to be Echo?
Okay, so that was the video for Echo program. We would like to call again Dr. Sato, Dr. Sam, and Ms. Madni and Ms. Kylie, and for a photo session for the launch this.
Holding it. I'll show it the other way. Okay.
Thank you. So that's about it. Yeah. So before the event ends, I do apologize for any inconvenience caused. Yeah, for the wait and the technical error. And here's the QR code. Yeah, for the program sign up. Yeah, so those of you who are already decided to sign up, you can just register here. However, those of you who still need more clarification, there's a booth outside where Malini and Kali will be there to clear up your doubts, and then you can sign up there and register. Okay, and before we adjourn, we are going to get a group photo. Yes? Is that what all lady was called? Yeah, so here, maybe you want to fill up the gaps, yeah, so that everybody will be
Okay, everyone, smile. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, just like give like a thumbs up or anything. Okay, 1, 2, 3. Okay, one more time. 1, 2, 3. Okay, thank you so much, everyone.
So outside, please enjoy the food there, but please do not find anything inside. All right, thank you so much, and see you all soon.